Hello, everybody, and thank you so much for joining us today. I'll give everybody just a second to get into the meeting, make sure that everybody can hear me. You should be muted, and your cameras shouldn't be on, but I just want to give everyone a second to get here. We are being recorded. This is going to go onto our YouTube channel. If you have missed any of our previous chats, then those will be on our YouTube channel as well. So make sure to go to our LUX YouTube, like and subscribe. That way you can keep up to date with all of our, everything that we have going on and our events and learn more about our products. My name is Jasmine Alderson. I'm the spa director here at LUXA Medical Spa. Just to give you a little bit of background, LUXA Medical Spa, most of you have probably heard this spiel from me already, so bear with me. But LUXA Medical Spa has been open since 2014. We are co-owned by both a plastic surgeon and a dermatologist. Our plastic surgeon is Dr. Frederick Winiger. You may also know him from Winiger Plastic Surgery. And our dermatologist is Dr. Carmen Treweg. You may also know her from May River Dermatology. So not only is LUXA Medical Spa co-owned by those two physicians, but those two physicians are also the physicians behind Lumen. So Dr. Treweg and Dr. Winiger created Lumen Skincare about, I think in 2017 is when we launched it. So they work with a chemist, John, to develop the line. And joining us today is Jamel. So Jamel works directly with John, and she's an expert in these products. So this week, well, about a week ago, we launched a brand new line of Lumen Skincare products. So that's what Jamel is going to talk to us about today. If you are watching us via Zoom, then please use the chat feature to send us any questions you may have. We're also trying to go live on Facebook, so if that ends up happening and you're watching us via Facebook, please comment in the comment section and we'll make sure your questions get answered. So I am going to, at this time, turn it over to Jamel. Jamel, thank you so much for joining us today.
Hi, Jasmine. Thank you. And thank you, everybody that is here with us today to talk about Lumen's new line of growth factor products. So we will get started, and please, as we go through, if you have any questions, Jasmine will read them and we can answer them together. So to talk about growth factors and anti-aging, the barrier function benefits of kinetin. So kinetin is the growth factor that we're using in our Lumen products, and that is actually a plant-derived growth factor. So for those of you that have used other growth factors in the past, they may be plant-derived, they may also be human growth factors. So the difference would be if you are concerned about using something that is animal-based, these are completely vegan products. And to talk about the benefits of growth factors, they are extremely important to the skin's barrier. And our skin's natural protective barrier is our first line of defense against environmental damage. So pollution, UV radiation, stress, which I'm sure are all experiencing a little bit of these days, and disease. So when we talk about a healthy barrier function, it means that our skin is intact, it's not excessively dry, we don't have eczema or psoriasis or rosacea or acne. Those are all different types of conditions that can occur from a disruption of our barrier function. So our healthy barrier, our skin's natural barrier, is comprised of 3 ingredients. Those are cholesterols, fatty acids, and ceramides. And so to mimic that healthy barrier, we can supplement those to our skin and also take care of it in terms of using our SPF every day, making sure that we're drinking enough water. It is our largest organ, so we have to take care of it both inside and out. But you can tell beautiful, healthy barrier function by just the look of the skin. So when you have dysfunction, it will lead to premature signs of aging, which would be uneven skin tone, it would be wrinkles, it would be laxity or sagging of the skin. When we have increased moisture content in our skin, it will thicken the uppermost layers, which will give us smoother texture, reduce roughness, and give our skin a really healthy plumpness to it. When we're talking about the reduction of transepidermal water loss, our skin, if it is unhealthy, will actually allow water to be released from it. So besides our breathing and our exertion and everything else that makes our body lose water, we can actually lose it through our skin. And so if your skin feels tight and dry, that can be transepidermal water loss. So by putting a moisturizer on, Kinetin is going to help with that substantially. That's one of its major benefits. It will also reduce the appearance of fine lines and wrinkles and redness in the skin. And it protects against oxidative and glycoxidative damage. And what that is, oxidative stress is also going to cause premature signs of aging. Creates uneven skin tone, makes rough texture, breaks down the essential proteins that support the skin and cause that sagging and laxity. So Kinetin has a lot of different functions to help with moisturization. Really most important is that healthy barrier function that helps to protect us from all of the other things that we might be fighting or experiencing or trying to prevent. In addition, our Lumen products are all clinical strength. We are supervised by our physicians that created our line. They are paraben-free. They are all free of fragrance. They're vegan, so there's no animal byproducts in anything, and they are never tested on animals. To get into our new line of growth factor-based products, we have Restoration plus GF, that's our growth factor. So for those of you that may have used Restoration in the past, it is now bigger and better because of the growth factor that is supplied in it as well. So Restoration has multiple other benefits to it and ingredients that are going to help the skin. If you are concerned about aging and texture is one of your primary concerns, whether that's fine lines or wrinkles or roughness or large pores, Restoration is an amazing product. It contains antioxidants, so it has your daily antioxidants, vitamin C, vitamin E, ferulic acid that are going to protect you from cell mutation and UV radiation, brighten your skin. It also has vitamin A in it. So for those of you that are already using retinol or retinoic acid, this one is going to have a gentle but extremely useful source of vitamin A in it for anti-aging. So that's going to help with skin texture, stimulate collagen production and elastin production, help with reducing the oil production that you might be experiencing. In addition to that, there are peptides in here. It's going to help with moisturization. The Kinetin in there is going to lock in moisture and reduce the water loss you might experience. There's a nice acid in here that will actually help to gently exfoliate your skin fairly rapidly. So we do supply a trial size of our moisture therapy with the growth factor, and that will help with any dryness or flakiness you might experience from the use of the Restoration. We suggest, if you've never used it, to use it every other night and alternate it with the moisture therapy until your skin acclimates to the use of it every night. The first thing that you're going to notice is smoother, more reflective skin. That is part of that exfoliation that you're going to experience. And then as you continue to use it, you're going to start to see the reduction in the wrinkles, in your pore size, just have a more vibrant complexion with thicker, healthier tissue. This is for sensitive skin, which would include somebody that's experienced redness or rosacea, dry skin, normal, and combination skin. So if your concern is a very simple regimen of aging with associated texture, then this is a really great one-step product for you. Our Neck Define with the Kinetin Growth Factor is going to do all of those things, but it's going to do it in the area beneath your jawline and all the way down onto your décolleté or your chest if you want to treat there. So it is specifically formulated for the delicate tissue on the neck that can't be treated as aggressively as the face. So we need to use different concentrations and different types of acids and peptides. The neck often experiences something, if you've had a lot of sun damage in your past, it is something that we call poikiloderma. So it appears on the sides of your neck and sometimes down a little bit further. It might feel like little kind of chicken skin, little bumpy, rough texture. And then you might also see some redness in that area. So this Nectifine plus the growth factor will also help to address that concern, smooth that texture, reduce the redness, the laxity that we see underneath our jawline, underneath our chin. It will help with that. The fine lines, the deeper wrinkles, help to pull and tighten that skin for you. If you are under 30, it is a really great product to prevent. We do have Nectifine without the growth factor, but the growth factor helps substantially because it will help with the moisturization and just the overall feel and health and suppleness of the tissue on your neck and on your chest. It will also help you to tolerate some of the other stronger ingredients that are already provided in the Nectifine. So again, we have antioxidants, peptides, acids, and we do have a vitamin A in here. So we are stimulating collagen and elastin in that area as well. This is for all skin types. If you feel like you can tolerate every night, that is wonderful. If you might need a little bit more attention in the area of your neck and chest, then I would suggest trying to use it twice a day, but definitely start slowly, start every other night or nightly. And then if you feel like you can tolerate it more frequently, you can do it in the daytime as well. Please make sure that you are using a sunscreen, not only on your face, but down onto your neck and chest daily to protect it as well. That will make a huge difference in improving the appearance of that area, but also protecting it from future damage. Our
Angel,
antioxidant.
Called you Angel. Jamel, we have a question. Someone asked, could you use Restoration or Nectifine on the back of your hands?
You certainly could. There's no reason that you couldn't. The hands are tough because they get washed so frequently, and especially now as we are probably washing more frequently than we ever had. So if you are going to treat at night, I would use the stronger of the two. I would use your Restoration to treat the back of your hands prior to going to sleep so that you can have it in contact with the skin for a longer period of time. If you try to treat during the day, it's very difficult. Again, if you can use sunscreen on the back of your hands during the day, or if you're going to be out playing golf or tennis or doing something outside, make sure that you cover them up if you can. They make a lot of really nice sun protective gloves that will help with the aging or the prevention of aging of the back of the hands. But for that purpose, that's a really great question. I would suggest the Restoration. It is stronger than the Nectifine.
Great, thank you. And if anybody else has any questions, please use the chat feature and we will get those answers for you. We're really excited about this product. We love to know what you would like to know about it.
Thank you, Jasmine. Our Antioxidant Eye plus the growth factor is actually even more robust than our original Antioxidant Eye. So if you've ever used the Antioxidant Eye from our Lumen line, it is very moisturizing, it has antioxidants, it has peptides, it has a very gentle acid. Our Antioxidant Eye plus growth factor actually has added a vitamin A to it. So it is just more robust for anti-aging. It also has the growth factor that's going to help with additional hydration, improve the appearance of lax, crepey, wrinkles, fine lines on that eye area. You would use this on somebody that is over 35. I would suggest our Antioxidant Eye for somebody that's more in the prevention stage of taking care of their eyes. This would be for somebody that we are preventing, but we are also now treating. So if you are already getting neuromodulators in that area, then this would be something I would certainly pair with that immediately. If you can only use it at one time, day or night, that is fine. But if you can use it twice a day, that is even better. It is extremely tolerable, but you will start to see improvement quickly. It feels amazing on the area of the eye. I would treat above and below. Not on your lid, but you can treat around your orbital bone, so the bone that encircles your eye. Put the product there. That skin is so thin and fragile that it actually pulls product closer to your eye and to your lash line. So you don't want to put it any closer than that bone, that rim, or you may get it into your eye. So please be cautious of that. This is going to help with a little bit of eye puffiness. Eye puffiness is a little bit tricky because it can be from allergies. It can also be a fat pad, and that would be something to talk to Dr. Winiger about if that's a concern for you. If it is just puffiness from water retention, this will help with that. If you have dark circles that make you look tired, not if it's pigment on the eye, that will be something different to talk to the staff about. But if you have dark circles that is trapped stagnant blood beneath the eye, this will help with the microcirculation so that that brightens that under eye area that makes us look like we're a little bit tired. So this addresses just about anything that you could possibly be concerned with in and around the area of the eye. Now this one isn't new to us, but I think it's very notable because our lips are also a very important factor, and they do tend to show a sign of us aging prematurely. So our Renew and Restore Lip Kit also contains our Antioxidant Growth Factor in the AM product. So our AM product is intended to protect the lip and hydrate the lip. Both of the products have a squalane gel base, and that is an olive gel that feels very rich and hydrating, looks a little glossy. The daytime product also has a mineral SPF of 30 that will protect your lips because the tissue there is very fragile and often goes unprotected. So you will be protecting in two ways, both from the antioxidant and then from also the SPF that's chemical free. Quinatin is in that AM product, so you'll get a lot of moisturization and increase of suppleness from that ingredient. At night, you're going to use the PM product, and the PM product is meant to plump the tissue naturally over time with continued use. So they both work very synergistically together. They both have very different ingredients in them and are meant for different things. But when you use them both daily and nightly, you will see an improvement. Now, there are a lot of products on the market meant to plump the lip that are actually plumping it almost immediately. What you're seeing when you buy those products is usually an ingredient that does plump the skin, but it's in a reaction of inflammation. So you'll see the lip plump because it's irritated, and so you do get that nice effect, but it's not something that is lasting. It's something that will only be there while you're using it, and that might be great for some. This product is meant to plump by stimulating collagen production and helping to restore the volume within the lip. So our nighttime product has a little acid in it, a little lactic acid that will help to smooth that tissue as you sleep. So when we get rough lips. Then it also has hyaluronic acid in different weights so that you'll get plumping from that. Whenever you get filler, most filler is hyaluronic acid, just very, very dense, and that's what helps our bodies have hyaluronic acid. So we're just helping to restore and supplement that. And then in addition, you will have some peptides in here that will also help with that plumping effect. So over time, you will also see an improvement. If you have any of those little lines around the edges of your lips, it will help with that. So at night, you might want to use your product a little bit outside of that. Again, we're always talking about prevention and treatment. So this can be used for patients of any age. If you are already getting filler, then I would suggest this be added to your regimen whenever you come into the clinic and have the staff do lip filler for you. And then if you're not quite ready for that, this is a really great way to help prevent the reduction or the decrease in the volume of your lips and to protect them from UV damage. So this is another great product that we have in the clinic. Does anybody have any questions about growth factors or any of the products individually?
Yeah, a couple of questions have come through. Question, do any of the lotions help dark spots?
These ones specifically don't, and that is a really good question, but we do have a few other products in the Lumen line that do help with dark spots. So if you are dealing with any of those, we can give you a free virtual consultation right now during this month and help you find something that would be best for you. These particular products are not intended for the treatment of spots, though. Good question.
That is a great question. Yes, and I tell people, these talks are wonderful, so you can get, information on our different stuff. But the best source of knowledge comes from doing the consults with the estheticians, because they're going to help you individualize the products and teach you how to use them and when to use them, which actually is a good segue into the next question. So question. Should you use vitamin C serum in the morning when using restoration at night?
You certainly can. That is a really great question. If you have your vitamin C and you want to use it in the daytime for protection under your moisturizer and your sunscreen, Absolutely. You know, I think just like we take supplemental or supplemental vitamin C internally, and we probably take far more than we need, I think it is also a good idea to use your vitamin C in the daytime as well, just because there's so much in the air besides the UV, the sun that we're getting, the pollution and the different factors. I think it's a great idea. Yes.
Perfect. Another question, what ingredients help plump the PM lip kit?
The PM lip kit, so the plumping is coming from the use of the vitamin A. So there's vitamin C in the daytime and vitamin A in the PM, and both of those are helping stimulate collagen. They're helping us to, they're giving us the supplemental ingredients that we need to produce that naturally. The peptides that are in there are also going to stimulate that plumping in the lip. And then we also have the hyaluronic acid, and hyaluronic acid's job is to hold 1,000 times its weight in water. So that will also naturally help to plump the tissue. It won't be that immediate plumping that you see from some of those other products that we talked about on the market that create that kind of inflammatory immediate plumping, but you will start to see an improvement over time and use of the product. And you are doing other things to create a healthy environment within the lip.
Very good. Someone said they love their lip kit, and someone else said their 10-year-old daughter uses hers. She said,
Talk
Allie,
about prevention.
because it feels so good. It really does.
Thank you. Thanks for
What?
saying that. That's great feedback.
Yeah. Hold on. There's another question. A question about hyaluronic acid and explaining why an acid is hydrating.
That's a good question. So hyaluronic acid does have acid in it, just like retinoic acid, which is vitamin A, but they're actually fatty acids. So they're different types of acids. These aren't hydroxy acids that you would think of. That said, lactic acid is also hydrating because it stimulates our body's ability to create its own hydration. So lactic acid is also in that PM product, and so it will exfoliate, but it is also meant to help naturally stimulate hydration within the skin. So if you've ever done a chemical peel, the immediate result that you see is going to be maybe dry, flaky, maybe red. But after you recover from the initial peel process, your skin is plump and smooth and bright. And so it's similar in response to what you get from that, just on a much lower concentration on a daily exposure level.
Awesome. Good questions. Does anybody else have any additional questions? Are you excited to try the growth factors? I am. I got I can't decide if I want to start with the neck or the eye. Probably both, I guess.
Yeah, simultaneously, yes.
Yes. But I'm excited for those for sure. Well, I know that everyone is probably really excited, and I know that you're here to get the information, but it's also, I know you're also here to get the information, but you're here to see if you won or not. So let's get to that. I'm going to take over our screen. And Jamel, if you don't mind, in just a second, verify. Can you see my screen that has the just the white background that says Zoom?
Yes, and it says new to working from home.
Yes, perfect. Okay, so here's my picker wheel. I'm going to shuffle everybody again. So with this, the winner will have their choice. Erin Hutchinson, our nurse practitioner who's on, she says that it's a good idea to rotate. So she's been rotating her Antioxidant Eye with Growth Factor between her Renew and Restore Eye Kit. What do you think about that, Jamel?
I love it. Why not? Yeah, that's a great idea.
Good, good. Jamel, what's your favorite growth factor? Or do you use all of them?
The neck and the eye are my favorite.
Yeah.
Yeah, can't live
Awesome.
without them every day and night.
Awesome. Awesome. Okay, so I'm going to shuffle this. So the winner of this prize will get to choose between the 4 products that Jamel talked to us about today. So again, that was the AM/PM Lip, the Nectifine with the Growth Factor, the Antioxidant Eye with the Growth Factor, or the Restoration with the Growth Factor. And again, if you don't know which one you should pick or need help deciding how to put it into your routine, we do have our estheticians that can offer a free free virtual consultation and help you pick. So I'm going to, let me make sure my volume is on because you guys have to hear this. Fun little sound effect. Chelsea, congratulations. And I will say, yes, congratulations, Chelsea. Thank you so much for being here. And people, if you noticed, there were added names. Those added names, people get bonus points when they tagged friends and liked. So congratulations on that. If you need to, like Jamel said, we have our virtual consultations are free through the end of the month. So if you still need to take advantage of our specials for this month, they end tomorrow. Go to luxhhi.com. The first thing that's going to pop up is this lovely lady, and you can just click there to schedule. Pick a time. You'll get a call from me that will verify the day and the time and the provider you want to speak with, because I'll pick the best provider for you based on what you want to talk to them about. And then, but if you need to shop the site, just close that down. We don't have any more virtual events, so just ignore this one. Today's our last one. I'll be sad not talking to you guys every day. So you just shop now, and that will take you, and this takes you to the open house specials, but this is where you can go on a monthly basis to see what our monthly specials are. So just to our store.luxhhi.com. So last chance to take advantage of everything that we have on special this month. And you'll see it's all right there. The only thing that you won't see online is the skincare. We can't sell that online. But there was something else. Oh, we do have, today is National Coffee Day. So if you're enjoying these contests, we do have a post on our national or on our Instagram where you have a chance to win a hydrofacial and a coffee gift card to one of our local partners. So that's a lot of fun. And if anyone else, no, Chelsea, you do not have to have your consultation by tomorrow. You do if you want to take advantage of any of the specials, but if you book a consultation before the end of the month, that consultation will be free no matter when the consultation is. But if you are booking so that you can get the specials, you do have to purchase the specials before the end of the month, so before tomorrow. But if anyone doesn't have, if there's not any more questions, then, oh, as I said, they were going to ask you about my fave. I think the neck is going to be my favorite. For 10 years or so, I've been using medical grade skincare, and I've used it really good on my face, but I've not been as great about doing my neck. So I think I need to play some catch up with my neck. So I think my neck is going to be, or the neck will be my new fave.
Oh, good.
So
it's never too late.
That, and that's right. That's right. That's true too. And plus, there's so many great products out there, but I think that this neck product really stands out as a good product. So, perfect. Well, if anybody has any additional questions, feel free to give us a call or schedule a consult so you can get in with an esthetician or with Erin, our nurse practitioner, or with Susan Coker or Karen Bouchard, our PAs. That's all we have for today, and thank you, everyone. This is the last virtual open house presentation that we're doing. So thank you for everyone who's been watching and spending time with us each day. We really appreciate that, and we're so sorry that we can't see you in the office for these big events, but hopefully soon. So I'll if anybody has anything, you feel free to stay on, but in just a couple of minutes, or just a couple of seconds probably, I'm going to hit the hang up button. All
Thanks,
right.
Jasmine.
People are dropping off like flies now. So thank you, Jamel, so much for being here and doing these with me. I appreciate it. I hope
Absolutely.
you have a great rest
Thank
of
you.
your day.
Thanks, you
All
too.
right.
Bye-bye.
Thank you. Bye.